Visibly frustrated, the World Health Organization chief made his views known again on the challenge of access to vaccines.
So let's be real. What we need is vaccines. The problem is lack of vaccines. It's not delivery. It's not, problem in absorption by and large. We can have that maybe when we have more vaccines. It's lack of vaccines. It's not hesitancy, it's lack of vaccines. And the situation in many countries, in low-income countries, especially in Africa, it's very worrisome. I said it many times, and I sent a tweet, actually, I posted a tweet yesterday about the worrying trend in Africa. It's becoming so dangerous. And the difference now is between having a vaccine and not having a vaccine. The difference is between the haves and the have-nots, and which is now completely exposing the unfairness of our world, the injustice, the inequality. That's it, let's face it. And that's the problem. And we need vaccines now. That's the issue. Then let's try if absorption or delivery is a problem. Let's see it. If hesitancy is a problem, it's not. Of course, there could be a problem, but that's marginal. That's secondary issue. That's secondary issue. We need vaccines now to save lives. And let's not go around the bush now. We need vaccines. That's the problem. And I will tell you another story. I had a meeting with the allocation team. There is an advisory group we established that can help us to allocate vaccines that's coming through the COVAX. They're frustrated. They're disappointed because there is no vaccine to allocate. No vaccine. So there is no allocation if there is no vaccine. What do you share if there is nothing to share? That's the reality. So let's focus. And as media people, please, you know the truth. Just focus on what is failing. The world, as international community, as the world is failing. As global community, we're failing. We're repeating the same mistake as HIV/AIDS, which took 10 years to reach the low-income countries after it was already rampant in high-income countries, and the H1N1 vaccines that was delivered to low-income countries after the pandemic, after the epidemic was over. Do we want to repeat the same thing? Can't we learn from what happened in the past? I think you know the answer. Please help us mobilize so the world comes back to its senses and help us open the world. The whole world is sick and tired of lockdowns. You can see it from how the citizens of the high-income countries are behaving now. They are so happy. It's opened up. Restaurants are full. The streets are full. Everywhere you go, you see crowds as if there is no pandemic. Then you go to countries where there is no vaccine access, still lockdowns. And the whole world is sick and tired, and the whole world wants to be opened up. And the tools are in our hands to open it up. So we need vaccine.
He didn't shy away from commenting on the situation in Tigray.
On Wednesday, a market outside the city of Mekelle in the Tigray region of Ethiopia was bombed, killing and wounding civilians. Ambulances were blocked for more than a day from attending the scene and evacuating the wounded for medical care. WHO is currently providing life-saving trauma and surgical supplies to a hospital that's treating survivors who are able to reach care. Attacks on civilians anywhere are completely unacceptable, and so is denying them access to immediate care because we lose lives.
The health body has also raised concerns about the Delta variant that is now circulating in many countries.
The Delta variant is a dangerous virus. It is more transmissible than the Alpha variant, which was extremely transmissible across Europe, across any country that it entered. The Delta variant is even more transmissible. We are seeing trajectories of incidents that are almost vertical in a number of countries around the world. Europe and many countries are seeing a decline in cases, but there are a lot of events that are occurring across the region. A lot of events, whether these are large events related to sporting events or religious events or even backyard barbecues. All of these actions have consequences, and the Delta variant is spreading readily among people who are unvaccinated. So even countries that have high percentages, remember, the entire population is not yet vaccinated. The entire population has not yet reached their second dose or the full course of dose. And the vaccines are aimed at preventing severe disease and death. They are incredibly effective at preventing severe disease and death, including against the Delta variant and the sublineages of the Delta variant that we are seeing. Remember, we have 4 variants of concern that are circulating. We have 7 variants of interest that we are tracking and a number of other alerts that are on our radar in terms of understanding what constellation of mutations are out there. The Delta variant, the virus will continue to evolve.
Sophie Mkwena, SABC News, Johannesburg.